Alrighty, welcome to chapter 2. And in this chapter, we're going to go over the basic schedule of applying to medical school and where I think you should be making particular interventions to kind of prepare yourself for that ultimate application cycle. So we're not necessarily going to be going over applying, the principles of applying at this point, but basically getting all of your ducks in a line so that you're going to have a successful run when you do actually formally submit an application into the cycle. So as you can see here, these are just some quick screenshots from PharmD to MD, my book, addressing the different points and particular things that I think you should do at that current time. So we're going to go into each one of these specifically and explore a little bit more. But for yourself, I recommend that you kind of check through them depending on what year you are to make sure you've kind of fulfilled each of the criteria. You don't have to follow it perfectly, and everyone's going to be a little bit different, but these are the general recommendations of when I think you should get things done. Now, this is also basing the schedule off of time where you are attempting to basically apply to medical school and matriculate into medical school immediately after following graduation of pharmacy school. So, for instance, when you graduate pharmacy school in May of a particular year, you would then start medical school in that summer in the following months after that. That way, you kind of minimize the downtime in between your education process. While it might seem challenging to get licensed and to you might want a break, it's not necessary, and it kind of keeps you going with things where you don't have that time off working as a pharmacist or making a little bit of extra money, which can kind of slow some of your momentum. So that's kind of just introducing this particular schedule. As you can see, you can look at all the information there, and some of it is some things we've already covered, so we won't fully go into each one, but we'll address each one in each subsequent lecture.